Good afternoon and welcome to TRUST, Seizure Recognition and First Aid. My name is Andrea Rassiopi and I'm Vice President of Epilepsy Services. Today we're going to be talking about seizure recognition and first aid, how to recognize common seizure types and their possible impact on students, know appropriate first aid for each of the types of seizures, recognize when a seizure is a medical emergency, and how to provide support to the person that's having the seizure or had the seizure. During today's presentation, everybody will be on mute, and if you have any questions, please type them into the questions section of your toolbar, and I'll be sure to answer them at the end of the presentation. So what is a seizure? A seizure is a brief excessive discharge of electrical activity in the brain that alters one or more of the following. Movement is what we all think of, a convulsion, but it can also affect sensation, behavior, and awareness. So what exactly is epilepsy? So epilepsy is a disease that involves recurrent unprovoked seizures. So it has to be at least two unprovoked seizures occurring greater than 24 hours apart. The seizure is the symptom of having epilepsy. Some people might actually call epilepsy a seizure disorder, so that's something you should keep in mind also. Up until a couple of years ago, we used to call epilepsy a chronic condition rather than a disease. One of the positives of calling a disease is that diseases can have cures, and cure is something that we strive for every day in the epilepsy community through all the research that is being done. Here are some statistics about epilepsy. 3 million Americans, more than 65 million people worldwide have epilepsy, 315,000 students in the United States, and more specifically 12,000 in New Jersey. More than 45,000 new cases are diagnosed annually in children. 1 in 26 people will develop epilepsy at some point in their lifetime. 1 in 10 people will have a seizure in their lifetime and never have another one. Epilepsy is more common than cerebral palsy, Parkinson's disease, muscular dystrophy, and multiple sclerosis combined. Most seizures are not medical emergencies. When somebody has epilepsy, they have seizures, so we don't need to call 911 every time they have a seizure. People may not be aware that they're having a seizure and may not remember what happened. Epilepsy is not contagious. You can't catch epilepsy by touching somebody while they're having a seizure. Epilepsy is not a form of mental illness. People almost never die or have brain damage during a seizure. There is something called SUDEP, sudden unexpected death in epilepsy, and that is something that's being researched by many scientists and neurologists right now. So in this situation, it's similar to the concept of SIDS. Somebody with epilepsy might unfortunately pass away, and there are lots of studies being done, and there's no firm reason why this might happen to some individuals. A person cannot swallow his or her tongue during a seizure. Your tongue's attached to the back of your mouth and it's not going anywhere. So never put anything in someone's mouth while they're having a seizure. You can't stop their tongue from going anywhere, or stop them from biting their tongue or swallowing it. But what we do say is turn the person on their side. If you turn the person on their side, their tongue will fall to the side and be relaxed and help them breathe easier at that time. Some common causes of epilepsy: for 30% of the population of people with epilepsy, there's a known cause. So that could be brain trauma, infections of the brain injury at birth. For the remaining 70% of people with epilepsy, the cause is unknown or presumed to be genetic in some. Going through a classification change of the different types of seizures. So this is just a graphic to show you. So there's focal onset, and that can include awareness or impaired awareness. Generalized onset includes impaired awareness. And lastly, unknown onset. There's over 20 different types of seizures, but the seizures we're talking about during today's presentations are the most common. There's two main seizure types. There's generalized and focal. Generalized includes the whole brain. Common types include generalized onset non-motor and tonic clonic. Symptoms include convulsions, staring, muscle spasms, or falls. Focal seizures only involve part of the brain. So whatever part of the brain is having a seizure at the time is what function is going to be affected. Common types include focal onset and focal onset impaired. There are over 20 different types of seizures, and people with epilepsy can have one type of seizure or several different types of seizures. It's important to remember that epilepsy is a spectrum disorder and very specific to the person. So please ask those questions and find out when it's an emergency for that person. Do any of their medications have side effects that you should know about? What do they usually do during their seizure? So first, we're going to be talking about generalized seizures. Generalized onset non-motor seizure, which used to be called absence, and before that used to be called petit mal. So this is like the little seizure. So during this type of seizure, the person will just stare off for a couple of seconds, 1 to 10 seconds. It may occur many times a day. It seems like they're daydreaming or not paying attention. During the time that they stare off, they won't remember what happened. And if you were to call their name during that seizure, they won't be able to hear you or respond to you. So it is hard to decipher sometimes, but the best way to tell is that if you call their name, they won't be able to respond. There's no seizure first aid for this type of seizure, but if you do notice it over a couple of weeks or a month's time in a student in your class, I would definitely ask the parents if they're noticing this behavior at home, because it could be seizures, and it's better to get them on track and help them control their seizures before the seizures might become a bigger seizure where consciousness is altered. Generalized tonic-clonic seizure used to be called grand mal, and this is the one everybody thinks of when they hear the word seizure. Generalized, the whole brain. Tonic, stiffening of the muscles. Clonic are your convulsions or shaking. So this is a timeline of what happens when somebody has a generalized tonic-clonic seizure. A sudden hoarse cry as air is let out of the diaphragm. Loss of consciousness. Then the person will fall to the ground, and then the convulsions will start. Stiffening of the arms and legs and rhythmic jerking. If one arm's moving, the other arm's moving. Shallow breathing and drooling may occur. Possible loss of bowel or bladder control. So if you have a student that has these types of seizures in your class, you should have a blanket or something that you can put on their lower half, because there is also an emergency medication that we'll be talking about in a bit that is administered rectally. Occasionally, skin, nails, lips may turn blue, generally last 1 to 3 minutes, usually followed by confusion, headache, tiredness, soreness, and speech difficulty. This is the type of seizure you can do the most to assist the person, and we came up with an acronym, and the acronym is TRUST. Each letter of the word TRUST will help you to remember what to do. First letter is T, is turn the person on their side. R is remove all objects and glasses. I also like to say remove unnecessary people. There's no need for the whole classroom to watch the student while they have a generalized tonic-clonic seizure. U is use something soft under the person's head, pillow, a blanket, a sweatshirt. If you don't have any of those things, just take your hand and stop the head from hitting the ground. S is stay calm and stay with the person. And lastly, time the seizure. Generally, for people that have generalized tonic-clonic seizures, it's an emergency if it goes over 5 minutes, but that can vary from person to person. So please ask when it is an emergency for that person. Dangerous first aid, you never want to put anything into someone's mouth while they're having a seizure. Don't hold down or restrain the person, and don't attempt to give oral medications, food, or drink during a seizure. So when is a seizure a medical emergency? If it's someone's first time seizure ever, yes, it's a medical emergency. So it's a family member that you know has no history, or it's a stranger and you have no idea and there's no one else around. Convulsive seizure lasting more than 5 minutes, unless otherwise noted. Repeated seizures without regaining consciousness. More seizures than usual or change in type. So if somebody usually has absence seizures and one day they have a generalized tonic-clonic seizure, that's cause for concern. Person is injured, is diabetes, or is pregnant. Seizure occurs in water. We just don't know how much water that person might have swallowed if they went under, so that is why that's an emergency. Next year, we're going to be speaking about focal seizures. So focal onset aware used to be called simple partial. During this type of seizure, full awareness is maintained. So I could be having a focal onset aware seizure right now and you wouldn't even know. So whatever part of the brain is having a focal onset aware seizures, what's going to be affected in the person. So rhythmic movements, say the part of my brain that controls my right hand has a focal onset aware seizure, my right hand might twitch a little bit. Sensory symptoms. I might feel some tingling, weakness. I might hear something that no one else hears. A funny smell in my nose, funny taste in my mouth, feeling of upset stomach or visual distortions. Psychic symptoms, deja vu, hallucinations, feeling of fear or anxiety or feeling they just can't explain. Usually lasts less than 1 minute. And again, the person is totally aware during this time. Often I've heard the story where somebody has lived for a while having these focal onset aware seizures and didn't realize it was out of the ordinary. And what happens one day is they have a bigger seizure, and that's when they get the diagnosis of epilepsy. You might also be familiar with the term that was always used. It's called an aura. An aura was always the warning before somebody was about to have a seizure, right? An aura is actually a focal onset aware seizure. So some people will actually have a focal onset aware seizure and then have a funny smell in their nose for a couple of seconds and then it's over. For others, they know that the focal onset aware seizure is actually a precursor to a seizure where awareness is altered. Focal onset impaired awareness seizure, which used to be called complex partial, is only part of the brain again, but during this type of seizure, the awareness is impaired and there's an inability to respond. Often begins with a blank gaze stare, and then the person will do certain automatisms. These are repetitive, nonsensical movements, so they might aimlessly walk, they might be clumsy, disoriented movements, lip smacking. They might speak, but what they're saying doesn't make sense. They might repeat the same phrase over and over again. It often lasts 1 to 3 minutes. The person will seem aware, but they're not. Often followed by tiredness, headache, or nausea. It's really important that you don't restrain the person while they're having a focal onset impaired awareness seizure because they can become combative. It can be confused with drunkenness or drug abuse or aggressive behavior. So often the behavior that people exhibit during a focal onset impaired awareness seizure is stereotypical to what they usually when they've had seizures in the past. So if you do know someone with these types of seizures, ask them what they usually do. They might say to you, I wander for 20 minutes, or I pick at my clothes for 5 minutes. And one of the reasons we want to know that is because for a focal onset impaired awareness seizure, it's an emergency if it goes 5 minutes beyond what's routine for that person. You obviously want to stay calm and reassure others, and most importantly, you want to direct the person away from any hazard. So if they're wandering, close the door and let them wander in the room. Obviously, direct them away from any hazards such as a hot stove or something sharp, and definitely don't restrain during this type of seizure. Seizure triggers. So these are things in the environment that cause somebody with epilepsy to have a breakthrough seizure. Some people have one seizure trigger, some people have several, some people have none. So not everybody with epilepsy is affected by blinking lights or flashing lights. That is a seizure trigger though. So blinking lights, flashing lights, strobe lights, but it can be something as small as a light dimming in overhead lighting in your classroom. It can cause somebody with epilepsy or photosensitive epilepsy to have a breakthrough seizure. Missed or late medications, the #1 reason for somebody to have a breakthrough seizure. Stress or anxiety lower the seizure threshold. Lack of sleep or fatigue. Hormonal changes, illness, alcohol or drug use, drug interaction, so that can be something like over-the-counter medication for a cough or a cold, overheating or overexertion. So there are some impact on learning and behavior. Seizures may cause short-term memory problems. After a seizure, coursework might have to be retaught. Seizure activity without physical symptoms can still affect learning. Many people with epilepsy are more likely to suffer from low self-esteem or depression, so keep that in mind. Medications also have side effects such as drowsiness, inattention, concentration difficulties, and behavior changes. So what you're seeing might not be epilepsy related, it might be medication related. Some additional slides I just wanted to include in this presentation: a convulsive seizure in a wheelchair. So somebody's in a wheelchair and they have a convulsive seizure. If they're in the wheelchair and they have epilepsy, they might actually have some padding on their wheelchair to protect their limbs from getting injured. You want to make sure that you lock the wheelchair so the wheelchair doesn't go anywhere. Fasten the seatbelt loosely to prevent the person from falling out of the chair. You want to make sure that you protect and support the head and ensure that breathing is unobstructed. And that's a seizure first aid protocol for a convulsive seizure in a wheelchair. A seizure on a school bus or a van, notify the base of the situation and location, safely pull over and stop the bus, and then you do regular seizure first aid protocol. So place the person on their side across the seat facing away from the back, or if necessary, you can put them in the aisle and then follow whatever your school policy is, whether it's call 911, call the parent, or call the school. Status epilepticus is medically defined as 30 minutes of uninterrupted seizure activity. It can include one long seizure or multiple seizures without recovery to baseline. This is absolutely a medical emergency and requires immediate action to stop the seizure activity. Intractable epilepsy. Intractable epilepsy is when somebody has failed to respond to standard drug therapy or different treatment modalities. They may also have underlying structural brain or neurological conditions, and they really pose the greatest challenge for all involved, including the neurologist and epileptologist. Speaking of treatment, so a majority of people with epilepsy are on the right medication and actually are able to control their seizures because of that medication. So that's a good thing. But some people don't have control with medication. So there's other treatments and other things that they can look into as far as assisting them with controlling their seizures. The ketogenic diet is one. This is actually based on the finding that burning fat for energy has an anti-seizure effect. It's not as easy as saying, it's the diet that people lose weight on. This is a medical treatment, not a fad diet. High fat content, no sugar, and low carbohydrate. And it really requires buy-in by everybody in the child's life, and no cheating is allowed. And some people find that they have less seizures or stop having seizures on the ketogenic diet. So it's just another option for parents primarily to use for their children that aren't getting that seizure control. There's also something called a modified Atkins diet that adults can use and follow. Vagus nerve stimulator is an implantable device. The device is implanted just under the skin in the chest with wires that attach to the vagus nerve, delivers intermittent electrical stimulation to the vagus nerve in the brain and in the neck that relays to the brain, and it hopefully lowers the amount of seizures that person has. You have to be a candidate for this medical implant and device, so it's something to talk to your doctor about. It comes with a magnet, so if the person feels like they're about to have a seizure or they're actively seizing, you can take the magnet and swipe it over the implantable device and hopefully stop the seizure from continuing or coming on altogether. The RNS system is an implantable device also that's intuitive, and it goes in the brain. So basically it monitors the brain activity 24 hours a day, 7 days a week. It detects unusual activity that can lead to a seizure, and it responds with a small electrical pulse to prevent a seizure from occurring. Diazepam Rectal Gel is also known as Diastat. This is a rescue medication. It's not given morning, noon, and night. This is administered rectally, and only school nurses in the school systems in New Jersey can administer this. And it's used to stop a seizure that will not stop on its own. Valtoco is a nasal spray in diazepam that also administers diazepam, but it's used for frequent seizures or cluster seizures. It's a rescue therapy, and it's just another option as far as a rescue medication for children 6 and over and in adults with epilepsy that isn't a rectal medication. Midazolam was the first nasal spray that was FDA approved. These are some supports that we have at Epilepsy Services in New Jersey. We have a prescription assistance program for those with epilepsy that are unable temporarily to pay for their medication, information and referral, scholarships, support groups, mentoring program. We have a week-long sleepaway camp for individuals with epilepsy and other developmental disabilities. Community Impact Board, so if you would like to volunteer and have an interest in advocacy, awareness, or fundraising. For advocacy, we were instrumental in passing Paul's Law at the beginning of last year, and that requires all school personnel in New Jersey to be trained on seizure first aid and recognition every 2 years. We have many trainings that we do throughout the state to build awareness, and these are a list of our upcoming activities and community events in the upcoming year. Our golf outing is in July. A day at the beach, we don't have a date yet because we wait for the governors to tell us that, but that is usually in July. Glow Walk Run is October 23rd, and that's at Liberty State Park. November is Epilepsy Awareness Month, and we're kicking that off with Paint the Pony Purple at the Stone Pony. And lastly, our Impact Awards are November 11th. Here's my contact information. Please feel free to reach out if you have any questions, my email, my cell phone number, and I'd be happy to answer any questions that anyone might have. Okay, at this point, we have no questions. So I'd like to make sure that you definitely copy down my email address if you have any questions or you think of anything tonight or tomorrow. I want to thank you all for being a part of today's presentation. And if you need any additional information about anything particular in our training, please let me know. Thank you and have a great day.